So amongst the causes of soft tissue injury to the knees, sporting activity probably in my practice is the biggest. Obviously road traffic accidents, etc. will create major trauma, but in my world it's all about sports, and the loading of a knee with rotation is the problem usually, or a rapid deceleration. And so certain sports have a particularly high instance of certain injuries. For example, rupture of the anterior cruciate ligament is related to problems with a bad landing from a jump or from a sudden change of direction that goes wrong. Probably the highest instance in UK sport is with netball. The problem with netball is you can't take a second step after you've landed, and there's this need to offload the ball quickly with rotation. Handball is a game we don't play very much, but a very high instance in that, probably for similar reasons. But most of my patients will come from football and rugby, where they suddenly have to change direction and the foot either gets slips or rolls, and then they twist the knee. Amongst many of my colleagues, however, skiing is a big cause of problems. The instance of injury in skiing is very high, and it's not surprising. You have a population of fairly well-off people who may be very sedentary during most of the year, and they decide to go skiing without much preparation. And not surprisingly, they get overloaded and they injure themselves. Many of these injuries are preventable. Of course, you do get bad luck, and even with the best preparation and prevention programs with strength and conditioning, people still get hurt. But I think there's good evidence now that prevention strategies with certain strength and conditioning exercises really do translate to reduced ACL rupture. And there are certain at-risk groups we really should be insisting on good preparation for sport. And the instance of ACL rupture in youngsters is going up and up as we become more competitive with sport. And it really is quite a scary scenario. And at the moment, it seems to be that there's a bit of a lack of interest in trying to prevent these injuries from clubs, from schools, etc. But kids really should be taught the various components of a preventative program of strength and conditioning, which improves their ability to absorb impact and absorb twisting on the knee. And they have been proven to work. So we should be doing that.